it's gonna be permanent.
I actually went to the same place they go to.
I do with some council's budget session.
Yes, sir. Pugh. Livingston. Malinowski. Livingston.
Yes.
Yes. English.
So, copy of the agenda. Continue.
It's approved.
This the general final.
Yes.
Sorry. So,
have all the resources available for them to deliver their programs and services. And last but not the least, our go-to to-go problem solver, Director Ham and her staff. So just wanted to acknowledge their hard work. Without their help, this budget recommendation package or the book wouldn't be completed. So moving forward, the first thing is we're going to talk about all the strategic budget initiatives that that administration is recommending for your consideration for fiscal year 2023. There are 4 budgetary initiatives, and all of them are aligned to your council's strategic goal for establishing operational excellence through competitive salaries. The first one is livable wages for all employees. The second one is cost of living adjustment for all employees. And let me share the presentation.
Share screen. Go to the green
Yeah.
one right there. There you go. Now share.
Yeah. Okay, perfect. Yeah. The third one is sustainable health insurance. Fourth is enabling effective recruitment and detention of detention officers, and the fifth one is for the last one is reorganization of departments. There is no fiscal impact associated with that, but just it will be a strategic change. Moving forward, so we'll talk about the first one is I think this one is not moving.
I can do it. You want me to?
Yeah, you can do it. That's fine. Yeah, perfect. So the first one is about to implement the livable wage for all employees. This is based on MIT's national data and local data for living wage calculations. As per MIT's calculation for the Richland County in 2021, the living wage should be $32,210. So that is the number that has been recommended, that increasing the minimum wage for entry-level positions or entry-level wage for living wage would be $32,210. That would be $16.52 per hour. The fiscal impact of this initiative would be on the general fund around $712,000. Currently in Richland County, there are 212 positions those are below 32,210 mark. The county's lowest wage is $24,199.50. Now, this is the number that the administration has recommended in budget. After our recommendation, MIT has updated their calculations, and now that number for Richland County is $33,384. If county decides to adopt that number for the minimum wage, the fiscal impact would be additional $315,000, additional to that $712,000. So moving forward, the second initiative is cost of living adjustment. As you may know, that Richland County employees have not received a budgeted wage increase or COLA since January 2029. Just to have, like, City of Columbia,
What year was that? Clarification? You said 2029.
Yes, January 2029, 29. 19, sorry about that.
2019.
2019, yeah. I'm thinking in future, I think, yeah. A time travel. So yeah, and City of Columbia, they had COLA implementation of 3% in January 2022, so this year. As you know, state of South Carolina, they had 2.5% COLA in 2021 and 3% COLA budgeted for upcoming fiscal year from July 2022. So with that, administration is recommending 4% pay raise for Richland County employees. That includes full-time and part-time and exclude the certified detention officers. The general fund impact of this initiative would be around $4.3 million. Moving forward, this is related to the pay raises to the certified detention officers, which are excluded from the previous COLA, the 4% COLA. So,
Recognize Ms. Newton. Sure.
that will apply to every employee which is on the payroll for Richland County. So that includes the coroner's office and sheriff's office, and not only 2020 Hampton Street. So it doesn't matter the location, as long as you are on the payroll for on Richland County payroll, that will affect.
Yes, ma'am. Mr. Deshpande. Oh, Mr. Malinowski, you recognized, and you, Ms. Barron.
What about elected officials then?
The elected officials, they are captured in right now. It's up to I'm considering the council members as well, elected officials. So, but the treasurer's office and such as the solicitor's office, they are also included in this COLA, and as well as the council members' impact is also calculated.
So all staff, just to make it clear, all staff is included. Any officials rate that is set by law in some shape, form, or fashion still applies to that law. So if there is an official that the salary says it has to be this for a period of time, we can't artificially change that. That will be subject to whatever laws that exist. But other than that, all personnel, all staff, that's included for. So, and what we're saying is we consider anyone that's not set to be included in that number. So the money is there for all positions, but we are aware that by law, there are some positions that have a set salary, and we're not changing that unless we are able to change that, but we have financially accounted for that.
Barron, you recognize.
Thank you, Mr. Chair. I did have a question. So as we look at the cost of living in adjustments across the board, will the individuals who are also receiving livable wages increase? Will they get a cost of living increase on top of what they're already going to be receiving?
So you mean when we change the minimum?
Correct.
Yeah, so the minimum is one number and the COLA is another number.
So, so if their minimum wage is less than 4%, then we will make their minimum wage to the additional, like we'll increase their salary to 4%. So let's say like if someone's increase is only 2% in the living wage adjustment, then we'll give that person additional 2%, and that will have or making 4% from their current base salary. So if they are like but if someone might get 7% living wage adjustment, they won't get it the 4% adjustment.
Okay, and if I may have a follow-up question. So with that, for example, if we have a staff member who is currently receiving $24,199.50, and they are, which means that they are below that amount, will they get their increase at one time, or will it be dispersed over a period of time?
That will be adjusted, so that 24,000, let's say like for this person, 24,000 who is making, their salary will be adjusted to 32,210, and that will be reflected in all the pay periods. So it's not a one-time increase, it will be annual increase throughout the year.
Yeah, so that was my question. I understood that it was an annual salary, but I just wanted to know, let's say at payday, if an individual was making 24,000 and now we pass this after our first budget cycle for this upcoming year, then they would see in that next check that increase.
That's right.
Thank you.
Mr. Pugh, you recognized, and then Mr. McBride.
Thank you, Mr. Chair. I just want to know, how did we come to the 4% raise that's recommended by Richland County?
So that's based on the MIT's study for the living wage, minimum living wage for Richland County. So they have the national data focus on based on the every county in the United States. So as per their calculation, the Richland County's minimum livable wage should be around 32,210. Now, that was when we were doing, when we had recommended budget. As of last week, they had updated that number, and that number is 33,000. I think that's the 33,384. That's their now current number. They might get that number might get updated as per, I think they're looking at the inflation rate and all the cost of living in particular local area. But as of right now, their current livable wage should be for Richland County as a 33,384.
Ms. McBride, and then Mr. Malinowski.
Chair, thank you.
Yes, ma'am.
I am happy to hear that that our employees that are now existing on unlivable wages will move up to halfway livable wages. But my confusion right now is that if we move them up to the 33,000 and some change that you mentioned, so now that makes them supposedly receiving livable wages for South Carolina, correct?
For Richland County.
For Richland County. Okay, now you are recommending a 4% cost of living wages. This is where I'm confused, right? So will they take, if they're gone up to $33,000, will they get the 4% cost of living raise on top of that, which seemingly would be fair because they were already at unlivable wages?
So as per the recommendation, let's say like if their living wage adjustment is more than 4% from their current base salary, they are not accounted to receive a COLA of 4%.
Okay, wait. This is where I'm confused. Right now, we're doing, we will give them that, if it's approved, they will have the salary of $33,000, okay? That's it. And other people may have salaries of $60,000, $50,000. So all these salaries exist now. Will everybody get the 4% on top?
So
I just want the clarification.
and the way that we have counted and calculated this number, the 4% COLA only you will get if your living wage adjustment is less than 4%. So I will go back to again the same example. Let's say if somebody's living wage adjustment is 7% compared to their current base salary, that person will not receive 4% COLA. And let's say like if someone's base salary, the living wage adjustment. Ms. Lauren would like to speak to it. Okay.
Ms.
Mr. Chair, if
Thomas,
I
you
may.
recognized.
Thank you. Let me see if I can try to make this a bit simpler. Everyone would get either the living wage or a 4% cost of living increase. Not both, but you would get a minimum of 4% increase. The reason that the people that would be getting the livable wage would not qualify under the current recommendation is that if we continue to move everyone up, we further exacerbate compression. So we're trying to adjust wages by 4%, but yet adjusting those people who are not making what we deem a livable wage to a point where they can sustain themselves. Does that answer the question?
That answers the question.
Okay.
Maybe not to my liking, but it answers the question.
Yes, ma'am. Thank you.
Got that look on your face, Ms. McBride, as if there's a follow-up, so.
No,
is there a follow-up?
we're not voting on this today.
All right. Mr. Malinowski, you're recognized.
Thank you, Mr. Chair. Two things, I don't need the answer now, but I'd like it in a hard copy, not some email nebulously sent at who knows what time of day or hour, or day. On your page 4, it says living wage calculations. I'd like to know what those calculations were, what they used in that calculation to come up with these figures. And following in that same line, it says based upon prior year data and a 1950 work week. I have no idea what you mean by a 1,950 work week. So if you can just get me that info, that'd be good.
Sure, but the 1950 I can answer quickly. That's like a 1950 hours during the year, work hours.
That's actually a 1950 work year.
No, work hours in a year. That's the number. Like if you're like Richland County, we have 1,950 work hours
In a year?
In a year, that's right. Yeah.
That says a week, yeah.
Okay.
Anything else, Mr. Malinowski?
Good, thank you.
All right. Mr. Deshpande, you may continue on.
Okay, sure. So moving forward, I think we are talking about the detention center employees and certified detention officers. So this is regarding, having the pay rates for the certified detention officers, which were excluded from the 4% COLA. The intent is to make sure that we are able to compete with the local detention center employers such as SCDOC, Department of Corrections, or maybe some local other county detention center employers. So as per the SCDOCs, which is Department of Corrections, their certified officers are paid around $39,140 at the minimum level, and that's like more than 7.24% than the current Richland County detention officer salaries. Hence, we budgeted 7.2% budget increase for certified detention officers. Starting that salary is recommended as $40,000 for certified detention officers. That will change and it will be adjusted throughout the salary structure for all detention officer ranks. The general fund fiscal impact is around $943,000 for this initiative.
Questions from the body? All right. See any? Recognize Ms. Newton.
Ms. Newton, new hires that are coming into that position who are not already certified officers have a year to work in that position in order to get certified to continue their employment as an officer. So you would be able to come in at that starting salary. So anyone that is hired as a officer at Richland County would, at a minimum, qualify for that starting salary of $40,000. That would be at a minimum. Thank you.
Additional questions from the body or comments? All right, Mr. Deshpande, you may continue.
So the fourth one is related to the county, the current health insurance benefit that we give to our employees and retirees. The intent here is to evaluate cost effectiveness of all available options to provide health insurance benefit to employees and the retirees. So we are looking at the current carrier, which is our Cigna, versus the South Carolina PIBA. So there are currently right now 3 fully insured options provided by Cigna, which is the buy-up plan, the choice plan, and the standard plan. As per the county's loss ratio, which is around 102%, Cigna has lost $9 million so far with the Richland County groups. At current loss ratio, the increase will be minimum 10% for 2022 2022 employees as well as employers, employer. Cigna has suggested elimination to buy a plan 80/20, which is our buy plan, as a cost containment measure, which would leave the county's highest coverage to 70-30 plan. With that, so in 2021, county has implemented Project Impact, a project to engage and inform employees regarding health insurance benefit, which began in October 2021. 7 committee meetings included active employees and retirees, and 3 virtual meetings were held. Excuse me. So the topics are provided in the and topics and meetings recorded can be found on that particular link. With that is really, so when we compare to our current plans, which are the 3 plans, which is the 3 Cigna plans, and compared to the equivalent PIBA plans, we are seeing a huge cost saving that could be for employer as well as employees. So the table that kind of gives an for FY 2023. Excuse me, Ms. Lori, can you take over? I'm sorry, I'm having still some.
Thank you. I won't do as well as Abby did, but I'll try to carry forward here. So if we were to migrate from our Cigna plan to the PIBA plan, during 2023, we would have to have a blended plan year. During that first blended plan year, on page 12, you would see that Richland County would save approximately $3.6 million, almost $3.7 million, and employees would save about $900,000. In this rate calculation, we've assumed that we would adjust rates so that no employee, while all employees other than 2 classes would pay less on the state plan, we would ensure that no employee would pay more than their current rate for health insurance. If we were to say with Cigna, that is not a viable option. At a 10% rate increase, employees would be looking at a rate increase, or Richland County would be looking at a rate increase equal to more than 10% itself. So any impact that a wage increase for employees may have, the employee may be somewhat mitigated by increased cost of insurance. The county also had a concern because currently under our PPO plans, we do not have deductibles that must be met prior to office visits. We've also calculated in this savings the potential to provide up to 2 deductibles depending on coverage for employees on a reimbursement basis. This would allow them to have no out-of-pocket costs initially, the same co-payments initially, and without any impact, and while saving money that they could be banking in their pockets for other additional costs that they may incur through some kinds of visits. The projected annual savings, as I said, for employees is approximately $1 million, and that will vary depending on how the coverage is laid out. It would also make our minimum plan an 80-20 plan, as is our buy-up plan now. Whereas our standard plan with Cigna, if that were to be the only plan that we might find ourselves able to afford, would only be a 70-30 plan. We've also looked at what a 5-year structure might look like on this, and on page 13 you'll find that. Initially, as I said, we're looking at about a $3.6 million savings, but over 5 years we're estimating $40 million in savings for the county. This is based on a Sigma plan increases that has a 10% increase in FY23, and that year is a split year, 22-23, because our current plan year does start in October. And then thereafter, only 7.5%. For this year, the state of South Carolina is considering passing an 18.1% increase to employers for their health care costs. We've included this cost in our proposed budget already. So the $3.6 million in savings is already after we would increase those costs by the 18.1%. So thereafter, on the assumptions for PIBA, we've considered 18.1% for FY23 and 24, and then 7.5% for the remaining 3 years to come to that $40 million savings. We realize that this is a lot of information, and it's a very sensitive issue for our employees. So if council would like to have another work session related specifically to health insurance, if you'll just let us know that, we're happy to schedule that at a point in time as well.
Recognized, I'm sorry, Ms. Mackey.
Thank you.
Had a moment.
Quick question about the insurance. So what our current plan right now that employees are on, what is the time frame in which that ends and we would have to make a decision with our current contract?
Our current contract with our carrier expires September the 30th. We have an unusual benefit year. It's October the 1st to September the 30th. If we were going to make a decision, we would have to do it 90 days prior to that, which does align with our budget process. We would also, at that point, we've calculated in a premium to ask our current carrier to potentially carry us for 3 months at a higher rate. And then shift for the following 6 months onto the state plan. We also considered and actually priced other plans with other private carriers. And we actually had those prices bid in July of last year. Unfortunately, for a fully insured program with our loss ratio, all of the costs are about where we are. So it's not that we're actually paying more than we should for health insurance. It's just that we have very rich benefits, and when you're a fully insured with a loss ratio like us, just as with your car insurance, if you have lots of accidents, you pay more.
Thank you.
All right, Mr. Livingston, then Ms. Newton, then Ms. English, and then Ms. McBride, and then Mr. Pugh.
My question is answered. I was going to ask a question about the loss ratio being very high and trying to figure out what are we doing to try to reduce that. And I want to know whether that was 1.9, whether that was high or not relative to everything else. And I think she said that. So
Yes, sir.
What we'll do about that in the future.
Yes, sir. It is relatively high, and we do have a wellness program as well. Our wellness program, while it has been touted, it is participatory, not outcomes based. So that is something that potentially we can look to do. However, it doesn't provide immediate results.
But it could save in the long term.
In the long term, potentially something that we might be able to do with some of the savings that we had would be some sort of a program for in-house care for employees.
Ms. Newton? Ms. Newton, you recognized. Okay. Ms. English?
I can clarify that for you, Ms. English. Actually, PIBA will only allow you to enroll once, so you wouldn't have that second premium. You would ultimately be saving the premium that you're currently paying to the county.
Ms. McBride and Mr. Pugh. All right, Ms. McBride.
So, this will save us, you said, how many millions of dollars?
3.6 in year one, and over 5 years, about $40 million.
In 5 years, $40 million. So that means if it's saving the county that amount of money, I'm thinking about the impact on the employees. Because it can't be saving the county that amount of money and not significantly impacting the employees and the benefits they're currently receiving. I don't receive county insurance, but I've heard that Richland County has some of the best insurance there is. And a lot of our employees are here because our insurance is so good. And we don't pay the best wages, but we do provide good insurance coverage for them. And if that impact, I'm just thinking about how significant that impact is and what it's going to do for the employees, especially those that we just tried to give livable wages to. And I know you say that the out-of-pocket money may not be as much up front, but it costs a lot with PIBA insurance. I have it, I know. So that's my concern, is the impact on our employees.
Yes, ma'am, Ms. McBride. Mr. Chair, may I just give a...
You're recognized, Mr. Brown.
And this is just for information. One of the things when I talked to the employees about that attended the virtual meetings, that attended the in-person meetings, with that this would be a discussion that we would need to have. That in order for us to really accomplish both wage increases and health benefits with one pot of money, I had to come up with some opportunities to address that. So this is an opportunity to address it. I did not indicate that this was a done deal. I said we would go before council and discuss that. So this is a part of that discussion. You are right, Ms. McBride, that there is a potential savings for both the employer and there's a potential savings for the employee. Now, related to the question about how does this affect employees, certainly in a group plan, it's all different. But what I would also ask us to consider is the majority of the resignations that we receive, none of them really mention benefits as a primary driver. They really focus on Richland County not being competitive in wages. I'm not saying that we totally dismantle a good benefit structure, but in order for us to have the level of financial wage increases and the financial health care benefit, that 3.6 number you're looking at, that's a potential savings, you add that back on top of your operating cost. So that's a projection of what it would take to both have the increased wages and the increased or the sustained health benefits. And potentially you may still have the employee possibly have to pay an increase. So we'll have to see what that looks like. So this is just a look, and that's what the budget process is, to give you some ideas, some indications of what we might have to consider. So I appreciate it. Definitely good feedback. I shared that with the employees as well. We knew that was going to be a tough challenge, but this is just the administrator's chance to look at options to try to address both issues with the same pot of money.
Mr. Brown, I understand that. So as this is just input, informational for us, I'm giving you input also.
Absolutely.
Okay.
Yes, ma'am. Thank you.
Thank you.
I actually have a question, and I'm not sure if this is for you, Mr. Brown, or Mr. Deshpande, or for you, ACA Thomas, but has staff been able to figure out yet, in the event we were to go this route, and if the county were to cover deductibles for employee health plans, have you all figured out a way to for the county to do that without it being counted as income or being taxed, if you will, taxable income against the employee?
All right, I am going to turn that over to the financial arm of the county. I don't know if it can be taxed.
We believe we have. We're still vetting that. We do believe it can be done as a reimbursement.
Thank you, Ms. Thomas.
Are there any other questions?
The questions from the body or comments or discussion? All right. Well, do I turn it back over to you, ACA Thomas, or Mr.
I will
Despondent?
take it over.
All right.
So moving forward, we're going towards general fund. The fifth initiative, which is basically the new departments, reorganization of the departments, where there will be independent procurement department and a new grants department. In the new grants department, there is associated FTE, which is the new FTE, new grants director. The fiscal impact overall together is 118,000 for that particular position. Moving forward to the general fund recommendations. Overall, you can see the general fund expenditure is 196 million, 764,000 and some change. As you can see that all the costs associated with all the strategic budget initiatives, those are accounted in, and the cost savings from the switching over to the health insurance provider, that is also associated, which is about 3.7 million. So if the council chooses to not to make a change in the current health insurance scenario, so that's something that we'll have to find some another source to fund expenditure. So we'll have to find 3.7 million additionally that could be coming from the use of fund balance or something else. The next slide talks about that the overall general fund transfer, which is the operating transfers to the special revenue and enterprise and some of the capital projects. Altogether, it's 10.3 million that general fund transfers will be done and accounted for fiscal year 23. Next slide. On the general fund revenue overview, you can see that the general fund revenue is projected at 189.7 million. There is a general fund transfer in from the hospitality and the accommodation tax, which is around 3,025,000. At this point, the use of fund balance is projected at 3.9 million, around 4 million there and total general fund sources are 196, which is the balancing to the expenditure. Moving forward, the next slide just talks about the general fund revenue overview, just breaking out all the different parts of money for the general fund revenue. Moving forward, so this is where this is just to give an idea about if council seeks this route to have additional way of additional general fund revenue generation, which is basically increasing the mill, increasing the taxes, which is the increase in the mill. As per the current estimates, the auditor's office, the revenue is projected with the no mill increase is 109 million and 624,000. With the mill cap, that would be 114.5 million. With the mill increase, revenue increase would be around 4.9 million, and the projected value of a mill is 1.83 million. So that's something council can consider if you are going towards that route in terms of increasing the mill.
Spondy, just 1 second. You recognize Mr. Livingston.
Do you have the number for the change in that mill from last year? That mill value?
Mr. Livingston, last year's mill was 1.69, this year is 1.83 million.
Continue, Mr. Bundy.
Yes. So next three slides just talks about all the allocation by department. If you have any particular question, I can go through that about the line item. Otherwise, we can move forward to the special revenue, which is the slide number 26. So again, here also the next three slides talks about the general fund.
Mr.
Sorry.
Chair?
Recognize Ms.
Yeah,
Malinowski.
before we move on, because you're on a lot of these pages really going fast, I'm just looking back at your page 22, summary by departments. The very second one, delegation, it shows what they requested at 341,000, and the recommended is almost 394,000. And I'm sure there will be others like that in here. Is there a general reason why there is a recommended amount over what the requested amount is?
So
Recognize Mr. Brown.
And you can certainly fill in, but particularly that department, the delegation, for example, for years, they had employees that were operating in two roles. So the former director who has retired was not only the director of the department and operated as the Veteran Services Officer, but also operated in additional roles. And now that they retire out, then those roles are separated out and have to be done as such, because you're not going to get someone to come in and actually do that role for that wage. So it's just something over time where they requested additional money from the county. We did not give it to them. The director has retired, and now those roles need to be taken care of, but they're separate roles. And the director at the time, which was Mr. James Brown, just did that continuously. And so that's one of those agencies where we have to fill multiple positions because a person retired that filled and did multiple jobs. But that's not something that you generally get to do. And that's why you see that, Mr. Malinowski. So both in the conversations with the position and the related salary, that's why you have, in that situation, that request.
And then how about further down, your auditor and business service center?
So I would have to take a
so-
look at both of those, but go ahead, Mr. Deshpande.
So the overall, the majority of the department that see the increase that is associated with their personal cost in terms of their employer contributions. So all the PBA retirement contributions, that is because that's where we saw the 1% increase overall in the PBA retirement contributions. So most of the increases are associated with their personal cost. And especially on the employer contribution side, which is the rates have increased across the board. The auditors, I think what you see is that overall that 2.5% increase from their last year budget compared to 2022.
Why do they get 2.5 and no one else does?
So there, and I will have to get back to you with a detailed calculation if that's what you are looking at. I don't have those detailed calculations in front of me, but that can be definitely provided to the council.
I can understand if in fact there's an increase in the deductions that we have to make for personnel, that we can't just not do that. But the auditor at 150,000, that seems like quite a large number right there. So, yeah, if you can get back to me.
As per auditor, I see 40,000 increase. I don't know, 150,000 there.
Well, 150 added on to 527 makes 677, and you got 678 up there, so to me, that's 150,000 over what they asked for.
Oh, so I'm looking at the FY22 adopted versus FY23 recommended.
No, I'm looking at what they requested this year
Yeah.
for 23 and what was recommended.
We can definitely give you the detailed calculations if that's something that you're interested in, sir.
I'd like to have it. The treasurer's another one right below it.
Sure.
Okay, thank you.
Rod, you recognized.
Just for clarification, and I don't have my glasses, so I can't see these figures. So the request that's being made by the departments, did we, last year, a couple of years ago, we asked them to reduce their request by a certain percentage? And I guess I'm directing this to Mr. Brown or you, Mr. Did we do that this year, or is this just a straight-out request from the departments with?
So the answer to your question is we did not ask departments to cut by a certain percentage. We did ask them to try to do their best to only request their needs. If you look back at the operational requests that were on your initial page, you will see that the departments actually requested over about $10 million than we recommended from an operational standpoint. On a personnel standpoint, I don't even have that number, but it's definitely more than what we recommended by a large margin. And so even with that, we went back in and we made some cuts as a part of the administrative process. So these do not represent everything that a department requested that they're getting. That's not what you have. This shows you what was requested and shows you what the administrator recommended ultimately, but I can certainly let you know that we did not tell anybody you have to cut this year.
Okay, that was my question.
We did not, Ms. McBride.
Okay.
No, ma'am.
Now, with going back to the delegation.
Yes, ma'am.
That's a mandate that we have to provide staffing for the Richland County delegation. Is that a state mandate, state law?
We do have to provide for them, and those two positions that I was talking about are listed in the budget book, and the one I'm looking at, and it is on the county website as well, was Veteran Affairs Claims Analyst, as well as the Delegation Admin Support Specialist. You had, again, multiple people doing multiple positions.
I understand that. Mhm.
Yes, ma'am, Ms. McBride.
So, this is, so it's required by state law. That's what I'm trying to find out.
The Veteran Service, we do have to provide.
For the state delegation.
We are required, yes, ma'am.
Okay, that was the question. And are they receiving funds, or do you know if they receive state funds?
They do receive a portion of state funds, and yes, ma'am, I do know that.
Okay. And does those funds help with personnel, or are they used for other things that you're not
I can't
sure?
speak to what the delegation allows them to use those funds for.
And the final question is that supposedly, I'm just going to, for example, if they had 3 positions, right? And I say they had 4 positions. Do you know how many positions they have?
So the positions that they had I think they had 4 full-time positions. Then they had some part-time. And they had 2 people operating in 2 positions, which were both Dr. Janha and Mr. Brown.
Okay. The final question, now what do they do for us?
So there are a couple of things. So they serve in the veteran services capacity. So for all those veterans in Richland County.
I'm just kidding, Mr. Brown.
Okay.
I'm just kidding.
Sorry. And they do the CTC program.
No,
as
yes.
well. Okay.
Thank you,
All right.
Mr. Brown. I'm serious. I'm serious.
Serious. Levinson, you recognize.
Mr. Brown, there seemed to be a big decrease in the our small business office. What accounts for that?
So, that's around 26% decrease
Right.
from there compared to the 2022. So the way that they represent is the overall, our personal expenditure, the salaries we are funding at 95% of the county-wide, 94 to 95%. personal expenditure we're funding. What we have noticed in the past is pre-pandemic 2 years and the pandemic 2 years, the personal expenditure is not utilized 100% for several different reasons by the department. So that basically that is budgeted there but not been expended, and it is basically the budget is unutilized. So what we are doing is basically in order to fund all other initiatives and the expenditure, where overall we develop a formula where overall the county's expenditure will be funded at 95%. With that, so in some departments, we are right now funding at 90%, 89%. So that's represent the OSBO's salaries represent funded at the 89%. Having said that, if they require more than that salary that we have budgeted for during the fiscal year, we'll be able to, the overall our estimated personal expenditure will be able to fund that additional salary expenditure from making some adjustment to the general fund personal expenditure as an overall as a county.
I'm just concerned because that was a huge cut when you talk about 26%.
Say it again, sir.
I thought that was a huge cut when you talk about 26%. I just want to understand why.
Yeah, but that's not entirely, the salary is not like 26% cut. It's around 89, so that's the 11%. And then after the FICA and all the employer contributions, that accounted all together in the dollar value, that's 26% there. Yeah.
Do we account for in every department any major one-time expenditures? You know, for example, someone got some funds last year for a management system, something very specific. We don't just roll that over, do we? Do we figure out a way to back that out because that was a one-time expense in that budget?
We do, Mr. Chair, and to your specific request or question, that's one of the things that we tried to address with a conversation that we started a couple of years ago about how you manage personnel dollars versus operating dollars. But we do not expect things that are one-time infusions to roll over. But then again, that gets into a conversation that we have with many officials and many departments about, I had the money last year, so I need it this year. So that kind of goes all into that pot of conversation.
And one last question, Mr. Chair, but I forgot what that was.
Feel free to.
Yes, I do. Yeah,
knock on the
it came
plexiglass.
back. And this is about capital costs. Now, in these various departments, you know, capital costs are somewhere else, so that doesn't tell the whole story about that particular department because.
That's correct.
What I like to, at some point, kind of know how much we're spending on these departments from the capital budget too, so I get a picture of the total budget for those departments.
Yes, sir. And this year, that would also include other infusions such as American Rescue Plan dollars, just as an overall look at a budget.
And I'm more concerned about the budget going forward
Sure.
in terms of, you know, the capital expenditure, you know, they're getting for this current year, so I can figure out what their total budget is for this, what we're voting on moving forward.
Understood.
Am I clear?
Yes, sir.
Okay, I wasn't sure. Thank you.
Aaron, you recognize, then Mr. Malinowski.
Thank you, Mr. Chair. So I'll start where Mr. Livingston left off, and my question would be, are we planning to show, as you say, the infusion, such as ARP dollars, in these numbers? Are they going to be reflected in these numbers with our budget?
No, ARP numbers are not calculated here, ma'am.
So I'm going to ask it another way just to make sure I'm clear. So if, for instance, we give, let's do this, the small business, the Office of Small Business, we give them $50 million from the ARP funding. And when we already know that that's already been allocated for them, that will not show up in these charts that we have.
It would not show up in the sense that the request that you are showing here are for operating dollars, but if in fact we had approved that, then what we are trying to do is we're trying to say where we gave you these funds that are one-time funds, then that's to displace or replace funds that you may have received in the general fund. So you may see a reduction in operating capital for your year, but we would know that outside of that, you did receive funds. It was just in a different revenue source.
Understood, thank you.
Yes,
And
ma'am.
my last question would be, I think this is where Mr. Malinowski started. As I look through this chart, there are variations of increases and decreases based upon request. And I outside of just saying, well, they requested $3.5 million, but administration has found that they need 4.3 million. Where are we getting these increases and the deductions from? I understand, as was previously mentioned about, actual expenses. So if you budget $800,000, but you only spend $500, realistically, that's what you need. So I understand those types of things. But when I look at this chart, there, I guess a footnote would probably be too much to have, but it just no consistency on how, or maybe you can explain to me how you are coming up with increases, decreases, or you get what you ask for, kind of thing.
So yes, ma'am, and so the consistency is in the process. So you're absolutely right. You won't see consistency across departments because the needs are different. Also, the departments themselves are different. And some of their responsibilities tie into the county in ways that other departments don't. So let me give you, I hate to use this as an example because I don't want the department to think I'm trying to call them out. But one of the departments that reached out to us during the process and talked about fiscal needs and personnel needs was the solicitor's office. One of the things that we know is that after the pandemic, not after because we're still in it, but once the court system got back into full gear, they received orders, not only them, but I think multiple judicial personnel did, to move cases, to get the system back running. And so they talked about the number of cases that they have that they got to get through and process, what that looks like across the state as compared to their office. And they looked at saying, hey, for example, we need, I think it was 2 attorneys and 2 paralegals to go with those attorneys. And maybe more than that. And we said, we understand you have a need. We can't address all of your needs and everybody else's needs. So what we'll do is we'll go ahead and we'll recommend 1 attorney and 1 paralegal. So did the solicitor get all he requested? No, he didn't. Did we fulfill his need? He might say that we did not. But in the process, we took that and took all of the other things that were in that pot and addressed that. Then you go to a place like operational services, and I apologize again, they feel like I'm picking on them, but operational services has requested, at least since I've been here, additional personnel staff to address the growing number of facilities that we have and the various operational needs, and has asked for double-digit personnel. We have not given them double-digit personnel because we said we identify and prioritize these other areas, and here's how we'll support you, but we can't support you with additional personnel right now. Even though that doesn't mean it's not what you need, but based on the priority that we have to set, here's how we're going to address it. So we walk through that process with every official in the county, and that's the uniformity that we have, to your point, Ms. Barron. But no, ma'am, we don't treat every request the same because depending on what's attached to the request, it may not be able to be treated the same.
Thank you, I understand. So I think that the details are inside the process that you all have, and we have to trust your process.
Well, and that's why we also tell the officials, here's what we're going to be doing. We're going to have a budget workshop, and if you want to speak, if there's something that I leave out as the administrator that you feel I have not appropriately represented, I will not be offended as a part of the process. come to the sessions and speak out. We've had that happen on a couple of occasions where we just talk through it, but I think part of that process is we do talk about and explain to them what we're trying to accomplish as a whole, overall budget, as just not looking at it as, I'm the only department you have to be concerned about. Every department feels that way, and they feel like the administrator doesn't care as much about them as another department. But the reality of it is, it's an overall county look that I have to manage and try to balance.
Thank you, Mr. Brown. Thank you, Mr. Chair.
Malinowski.
Thank you, Mr. Chair. Now, I realize that we can't have, like up here, we've got 2021 council adopted and actuals expended for 2021. And I know that we still have a couple months left for 2022. But does somebody have figures that shows the dollar amount that has been expended to date for 2022 for each of these departments?
That can be provided, sir.
Okay, yeah, I'd like to see that. Thank you.
Yes.
Mr. Brown, I have a question, and I think it's sort of along the same line as Ms. Barron's question. I believe Mr. Malinowski started out with this line of questioning as well. But I guess, I'm trying to, maybe you can help me figure out what's informing the administrator's recommendation. I'm not saying your recommendation specifically, but, as far as the rubric that's outlined here in the booklet. Like, for instance, I'm looking, let's not picking on anyone, let's take the solicitor's office. We'll just stay there for a second. The request was for $6.2 million, pretty much, right? But the recommendation from the administrator is $5.2 million. And then we get down to, say, the sheriff. The request was for $41,551,000, but the recommendation from the administrator is $41,594, which is $43,000 above what the sheriff's department has requested. So could you maybe enlighten me a little bit or enlighten this body as to what is informing the recommendations of staff or the administrator?
So a couple of things. So initially, the first thing comes from the department themselves. It's literally sitting down, listening to the department personnel, and many times it's the department head and his or her financial person, and then maybe their chief deputy. So that's the first thing. Around that also are there any mandates that we're required to address? Are there any compliance issues that these funds or these persons that you're asking for will require us to put resources towards? Once we get through that, some of that is also what is the general direction that the county has taken on these matters? So how do we routinely perform in these areas? What are the priorities, whether they've been established or they have been experienced, have been for the county? So all of those things kind of go into that pot as we maneuver these numbers. And then, once you start looking at all of the numbers and you get to the large number and you start saying, okay, well, what can I shave off? And then you go through that kind of same rubric. What things are compliance issues? What things are things that the county is going to want to address? What things have we heard that may have been initiatives that have been already talked about, but the budget process will bear them out. And so then you get to kind of the recommendation. And then we go from there and figure out, okay, here's what I thought I heard. Here's what I thought the direction would be. But let's go in and now council may come in and say, nope, you misheard a little bit. That's not quite where we were going. We don't see it that way. We want to do these things. And that's kind of what we're doing right now. So the recommendations are a combination really of what happens before I come back to you a second time and find out, am I aligning with what council wants? And then staff and other officials get to hear that as well, that the administrator, is in alignment, or that there's an alignment adjustment that needs to be made based off of some of the feedback that we're receiving. And so what we'll do from here is we'll adjust accordingly.
Additional questions or discussion from the body? All right, there being none, I continue on,
Okay.
Mr. Deshpande.
So just to conclude, the overall general fund expenditure that you can see that on slide number 24 is 183.22 million and some change there. That represents around 2.1 million more than what was adopted in 2022. That's overall 1.2% increase. Moving forward to the special revenue section, this is basically again the next three slides. They talk about all the special revenue that will be estimating for FY23. Altogether, we have estimated for all the special revenue 158.3 million and some change there. Any questions on those slides before moving towards expenditure side of the special revenue?
Questions from the body? Okay, continue on, Mr.
Perfect.
Deshpande.
Yeah. So moving forward to the next three slides, again, this gives you the summary of expenditure by funds. Basically, the special revenue expenditure is funded by fully funded by the revenue that the funds are generating. So if they are generating enough revenue, the expenditure is funded at the 100% there. So that again, the expenditure, that the total expenditure is estimated at 158.3 million and some change, matching with the revenue estimates. Any questions on this slide?
Malinowski and then Mr. Pugh.
Yeah, I want to go back to page 27 because when you say any questions on the next 3 pages, it takes me a little time to scan
Okay.
down 3 pages.
Sure.
The last one on page 27, victim assistance total. That's something that this council has been discussing for years and years, that it's not to increase over the amount that goes back from years ago. Yet now I see it's increased, pushing $200,000 here this year. Why is that when council has said we won't put any more into this?
Mr. Malinowski, I can address that question.
Okay.
Specifically because we can't not pay personnel for working. So if the solicitor or whomever is utilizing those resources and somebody works, the county is obligated to pay. Well, we cannot not pay for services rendered. So this is me talking to you. You can communicate to the official that you're not going to increase their budget, but if they go out and spend the money, then I, as the county administrator, cannot not pay the bill. So I understand what you're saying, but I don't have the authority not to pay a person for services rendered.
I understand what you're saying also, Mr. Administrator, and I realize it puts you in the middle of this whole thing, but maybe these folks need a little more hard talking to by somebody. Thank you.
Questions or comments from the body? You recognize Ms. McBride. Oh, I'm sorry, Mr. Pugh, then Ms. McBride.
Thank you, Mr. Chair. I just wanted some clarification on the Heathwood Academy budget line item. I know we discussed this at the last budget workshop last year, and I thought we was going in a different direction with funding that.
Which page number are you, sir, referring to?
On page 29, third from the bottom.
Oh, that's
1,907.
the resource officer that they're paying for.
997. I'm sorry.
Mr. Pugh, I think I can address that. That is for the school resource officers, but as per council directions, it is my understanding that the MOU that the Sheriff's Department has with Heathwood is that they are paying 100% of their school resource officer. We do have to account, though, for the expenditure, because we are getting we would be getting the revenue to cover it.
Thank you.
Essence, Ms. Thomas, they're reimbursing the county 100%? Okay. Ms. McBride and then Ms. Barron.
I'm glad to know that they're now reimbursing the county. That's a good thing. I guess I want to comment on Mr. Malinowski's statement. Now, the full council, each time we have this come before us, that's a different council, it's a different time. So that doesn't carry over what the council did last year and year before that, Mr. Malinowski, as you well know, in terms of whether we're going to fund victim assistance or not. And I think that was a discussion by some council members maybe a year or two ago. So I think that this is a very important program, and we need to take into consideration the victims and not just give out a flat no in which you are not doing in terms of compensating for the expenses. I didn't want the public to think that all of us are 100% against it. Thank you.
Malinowski, was Ms. Barron, but since you were mentioned, I'll let you.
Thank you. I just want
Ms.
to comment.
McBride and
I
then
don't
Ms.
have
Barron.
anything against supporting the victims either. What this all came down from is that it was one of those state mandates, and the state said, you will pay X dollar amount. And we did that, and we have done that year after year. And then it got to the point where the state was not holding up their end of the payments, and the county was picking up part of the state's. And so that's why I'm saying that we need to hold the state more accountable and put in their fair share as well, because we don't have a bottomless well here to keep paying everything that the state decides that we should be paying when it's their responsibility. That's all I'm trying to say. Thank you.
Mr. Chair,
Yes,
I just
Ms.
want
McBride.
to correct this. I'm not saying that Mr. Malinowski was against it, so you know that I'm not saying that. I was just saying that the rule from the county overall. So I think we're saying the same thing, but I'm allowing for the cost of expenditures.
Got the last word on that subject, Ms. McBride. Ms. Barron, you recognized.
Thank you, sir. I notice here that we do have line items for our school districts, and I remember, I'm scared to bring it up now. Last year, we did not actually have those budgets in hand. Are these numbers that have been requested actually from the school districts and with tangible documents to support this, or is this just a recommended number based upon your expertise?
Ms. Barron, are you specifically talking about their millage budgets or specifically the resource officers?
I'm talking,
Because these are just the SROs.
this is just SROs?
Yes, ma'am. We
Yeah.
haven't gotten the millage
Okay,
budget yet.
I do withdraw my question then.
Thank
So-
you.
Oh, actually, I have two
But to
questions.
answer that, we don't have those yet. They have not come down. We don't expect those until probably first part of next month.
Actually, I have two questions, and one does pertain to the line items for SROs. Is it administration's intention this year, Mr. Brown, to actually procure those signed MOUs from the school districts before we vote on a budget? Is that possible?
So if that is what is requested, we will certainly go to, normally those are affected by the sheriff's department, but we will certainly carry that message that we would like to have those in hand prior to see if they can get that done for us.
Well, please make sure that that message gets out.
Oh, I'm sorry, the chief, I'm sorry. I see the chief is here, sir. I don't know if you want to.
Oh, and good evening to you, Chief Paulus. You're recognized.
Good afternoon, Chairman. Yes, we have submitted the draft MOUs to the school districts. I have one signed in hand from District 5. I'm awaiting the other a couple more. I'll have those hopefully before second reading.
Thank you, Chief.
Thank you.
And my next question pertains to the road maintenance fee. I know that there was some litigation, and obviously we're not going to talk about that publicly, but I do know there's litigation around the county's, road user fee program. And so is that a factor at all with respect to this fiscal year's upcoming budget? I mean, I know that we are anticipating that the General Assembly is going to take some sort of action, but again, we are anticipating. But with that in mind, is that a factor with respect to this year's budget? Because I see that we have the road maintenance fee in here as a line item as well.
We do have it in there just as a traditional line item. We have not changed our expected utilization of that, but we haven't also used it since we talked about it before.
Okay. Additional questions or discussion from the body? Okay, continue on, Mr. Deshpande.
So, just moving forward, I think the last section is debt service obligations that the county has, and just providing all the details of the estimated debt service obligations. Just wanted to point out is the most recent GO bond obligation is captured in the first category, which is the general obligation. Overall, the total debt obligation for fiscal year 2023 is estimated at 152 million and 205,000 and some change. Any questions on the particular line items or the categories?
Questions from the body or discussion? All right, I'll continue on.
That concludes my presentation, sir. If any other questions?
Other questions before entertaining a motion? Ms. McBride, you're recognized.
Can I address this to Mr. Brown?
Yes, ma'am, you may.
Well, whoever can answer. Mr. Brown, what about the, when we're looking at compensation in terms of mileage, is this in this budget or is this going to be in another budget?
So,
given the cost of gas and everything, yeah. The mileage rate, the cost for travel mileage, is this in this budget or is it going to be presented in another part of the budget?
It's not usually a budgetary item that we present. Let me ask you, may I ask you a question?
Sure. Mm-hmm.
Are you asking for us to look at what the county has set as its reimbursement for travel to include per diems and all that associated with conferences, and is that kind of what you're asking about?
Yes, sir. And I was wondering whether that was a part of the budget, but you're saying that's not a part of the budget, but it is a part of the budget, but it's not come up during the budget process.
Yes, ma'am. That's correct. But we certainly taking it from here can look at that. Generally, in terms of the mileage, we use the calculations that are, I forgot what the name of the, thank you, the IRS. We utilize their mileage calculations for mileage, but I think you're also expanding it a little bit broader to those other areas that I talked about with the conferences, the meals per day for lunch, breakfast, that type of thing. That's kind of where, okay. So we'll take a look at that and come back with some recommendations for the council to consider in terms of keeping things the same or looking at a different rate for those items. I think that's come up before in previous discussions.
Thank you.
Welcome.
But
Mr. Livingston, you recognized.
Mr. Brown, what is the main driver in that total general operation debt? In that increase? Because it's about a $5 million, $4 million, $2.5 million increase. What's the main driver?
Right. So we obviously, I shouldn't say obviously, we recently had some new debt come on, which was the public safety complex. I'm not sure if that's what you're looking at, Mr. Livingston. So that was the most recent debt that we put out there to receive funds for the public safety complex in the amount of $40 million.
Thank you.
Questions from the body? Any discussion? There being none, I will entertain a motion.
Move to adjourn.
Second?
Move to properly second. Madam Clerk, take the vote, please.
Malinowski.
Yes.
Pugh.
Yes.
McBride.
Yes.
Livingston.
Yes.
Teratio.
Yes.
Joe Walker.
Adjourn.
Barron.
Yes.
O'Walker,
Yes.
Mackey,
Yes.
English, Newton.
Yes.
Motion approved.
Are adjourned.
Get together in the morning and come up with a recap.
It messes me up a lot too. What's that? You don't play. You don't play.
Hey, look,
Man, not on this committee.
I know I ain't got no time.
I'm going on the eating committee right now.
How are you, Patrick?
What?